Hello class, just a short video to review the lesson number 3 quiz. There's 5 questions. The quiz was worth 50 points, and each question being 10 points apiece. There is actually a standard deviation for this quiz of 9 points um, in terms of the scores. So I actually added 9 points to everyone's quiz if you had not scored 50. We had very few individuals that scored a perfect 50. Although we did have those individuals, the average score was instead in the lower 30s. So I did curve the quiz by 9 points, and you will see those updated grades in the grade book right now. I posted those a few minutes ago. The first question, Sarah is a 16-year-old girl who has been using speed for about 2 years. She uses speed intravenously, having originally started it for the first 12 months. On assessment, Sarah tells you she has been trying to cut down on her speed use and has even had a period of 2 weeks where she didn't use. She appears to be speeding when you met her or using. She's in preparation. She's thinking about change, but she's not sure she's ready to take action. But she has tried to find sobriety in the past. That kind of tells me she's in preparation. She's not contemplation, because she says she's trying to cut down. She could be pre-contemplation, that is, because she's trying to cut down. And contemplation, she's more than thinking about it. She's trying. That she's been trying to cut down her use. Preparation, so she's not only thinking about it, she's taking some action to get ready. Now she's currently using, so her willingness to take action may or may not be true. She's certainly not maintaining sobriety, and she hasn't necessarily relapsed because she doesn't have any time of sobriety behind her to speak of. I would say it's preparation. Some of us placed contemplation as the answer. I would be willing to debate that one with you, but preparation is the actual answer. After 6 years of sobriety, George has been using actively his drug of choice for the past 3 weeks. George comes into the office, says he's using, and really isn't sure what's happening. George has been sober in the past, and he's using again. He was sober for 6 years, but has been using for the past 3 weeks. That's relapse. That's really the only question, the only possible answer for this particular question is relapse. Number 3, James is a 14-year-old boy who smokes cannabis and tobacco. On assessment of his cannabis use, he states that he can take it or leave it. He tends to smoke with friends on the weekend. James smokes cigarettes whenever he can afford them. He also drinks alcohol to the point he blacks out once a month. It's pre-contemplation. James isn't even thinking about his actions. He's not thinking about the consequences of his actions, and he's not thinking about getting clean. He's in pre-contemplation. 4. Gracie is a 17-year-old female who is involved in drug court. She has a history of multiple drug use, poly means multiple, and has worked as a sex worker. Gracie has been trying to stay off cocaine and speed. She continues to drink heavily a couple of times a week and also takes street benzos, as she says this helps her sleep. Gracie's latest urinalysis reveals cannabis, benzodiazepines, and amphetamines. She's pretty worried she'll be taken off drug court, and she states she really wants to stay out of trouble. That's action. She is taking some type of action. She may not be staying clean, but for you to be in the action stage doesn't mean you have to be clean. It just means you're trying to do something to find sobriety. And her something is drug court. If she was clean, that would be maintenance, but she's not. And she's not thinking about finding sobriety or getting clean. She's doing more than thinking about it. she's taking action. Again, taking action does not mean you have to be successful. It just means you have to do something. Last but not least, you have been referred by social services for treatment after being clean for a year, following being deemed unfit as a parent for using drugs in the presence of your children. You have been actively involved in 12-step groups, and you're currently living in a halfway house. You have been working steadily the past 6 months. Given how well things are going, you're not sure what treatment has to offer you that you haven't already achieved. She's currently in maintenance. The client is clean, but they're trying to figure out, do I really need to continue this path, this road towards sobriety, and perhaps working the steps or managing and implementing my relapse prevention plan? So the client is maintenance. She's taking action, yes, but she's already sober. She's been sober for 6 months, and we're actually sober for a year, working for 6 months. So she's attempting to maintain her sobriety, and she has not used again. That's relapse. One of the sometimes when we talk about the stages, it's natural to get hung up on each individual stage happening in a particular order, and that we have to fit everybody in these stages. And that's not necessarily true. And I'll be honest with you, I'm much less concerned with students being able to determine what stage each individual client is in than I am in helping students acknowledge the fact that all clients are not the same, and they experience treatment and attempts to find sobriety in different ways, in their own way, in their own method, and with their own unique outcomes. And when we meet clients, we must meet them where they are, based on their willingness to participate and be involved in the treatment process. And that's really the most important thing we can do. So don't panic about, for some of us, we didn't do very well on this quiz. That's okay. Again, I added 9 points to everyone's quiz due to some statistical testing. And what I need us to do is I'll move on to the next quiz and the next lessons and continue learning about this concept that clients are different and they experience drug use and sobriety in different ways. Thanks.